All right. Welcome everyone to this week's edition of It's Worth a Shot. Today is October 5th, 2022. My name is Jessie Kinsey. I'm a registered nurse and account manager with Mountain Pacific Quality Health. On this week's edition of It's Worth a Shot, we'll be discussing the flu vaccine recommendations and chatting about flu vaccine hesitancy and some common concerns. Next slide, please. As always, just a few housekeeping items. Feel free to add your webinar topics and clinician ideas or needs into chat. You can also add those in at the very end when we put the survey into the chat box. You can free type any suggestions into there as well. We'll continue to meet every Wednesday, same time, same place. And we do have a polling question this week. Oh, I got ahead of myself there. As always, we extend many thanks to all our partners and guest speakers and for the attendees and our growing audience. We hope that the weekly series is beneficial for everybody. Polling question, are you planning on offering COVID-19 vaccine at the same time as other vaccines? We'll get some more folks to participate here. I know this has been a hot topic and it's highly encouraged. The more that we can normalize COVID-19 vaccine alongside the rest of our routine vaccines and offer more of a bundled approach to offer it with your flu vaccine, maybe your pneumo, there seems to be a higher uptake. Still a couple more polling questions coming in. It looks like we still have folks joining from the waiting room, so that's fantastic. And it sounds like there's some clinics being scheduled and one done. So awesome. I'm seeing some chat. Good job, you guys. And we still have folks in the polling. So we will count down and close that polling question. All right, it looks like the majority, 68% of you that responded said, yep, we try to offer the COVID vaccine along with other vaccinations. All right, thank you guys. See if I can close that. Bivalent flu vaccine done for residents, great. All right, so with that, we have Kyla Newland, our in-house pharmacist, joining us from Alaska today. And she's gonna start us off by talking about this flu season and the recommendation and giving us some highlights. Take it away, Kyla.
Thanks, Jessie. Hello, everyone. Thank you for joining us today. I'm just going to go through some flu updates for the season, and then Jessie is going to follow me with some common kind of hesitancy and vaccine questions, and then look at where we're at this season so far as flu activity. So we can go to the next slide. Basically, influenza burden can vary year to year based on a number of factors, including which circulating viruses there are, how well we matched the flu vaccine to the one that ends up circulating, since we have to produce the vaccine about 6 to 9 months before the actual season. It's always kind of a prediction. And then also depends on how many people receive the vaccine. Some years more people get it than others. And some years we see a lot higher rates than others. So just kind of a lot of factors that go into how much flu we see each season. And another factor that we saw, of course, in 2020 was with the mitigation strategies for COVID, we did see a very, very low flu prevalence that year, which probably all viruses, if we tracked them this closely, we would have seen that as well. We can go to the next slide, please. So this is basically just an estimate of the last 10 years. These are the number of illnesses from the flu, number of hospitalizations, and number of deaths. So these are significant numbers. And if you look at some of the years are a lot higher than others. So just kind of a historical perspective on the number of people that are that are affected or get the flu every year. Next slide, please. So what is the flu? Au contraire to what many folks might think, it is not the stomach flu, it is a respiratory virus. It has symptoms such as fever, cough, sore throat, runny or stuffy nose, muscle or body aches, headaches, fatigue, and some people even have GI symptoms when they have influenza, not as common, more the respiratory kind of symptoms. The period of contagiousness, so folks that are infected can actually infect others beginning one day before their symptoms start and up to 5 to 7 days after becoming sick. So as we know, you may be exposing people before you even know that you're sick. And so it is important to try to isolate, especially if you're going to be around folks that might be at higher risk for the flu, including those 65 and older, or folks with certain chronic conditions like asthma, heart disease, or diabetes. Pregnant women are also at higher risk, and children younger than 2. There can be severe complications from the flu, including pneumonia. Also, if folks do have those higher risk conditions, they can actually be aggravated or worsened if somebody does contract the flu. It can also cause like a hyperinflammatory response that can lead to things like sepsis. So it is important that we really assess risks and make sure that everybody gets the flu vaccine so that we don't have these kind of secondary things going on. Next slide, please. So this is just a chart that shows basically how they produce the flu vaccine and really how many flu viruses they kind of analyze from different locations in order to get that flu vaccine kind of dialed in the best they can each year. So this year, we did see a couple changes, and Jesse, thank you for putting that in the chat. The viral strains that have been put in our vaccine for this season. They did update both one of the influenza B strains, and also the H3N2, which is one of the A strains. So those were the 2 significant changes. All of our vaccines this year will be quadrivalent, and they contain 2 strains of influenza A and 2 strains of influenza B. We can go to the next slide. So what's new for this year? The CDC did come out with some preferential recommendations for those 65 and older, and they recommended these 3 specific vaccines because they have been shown in some studies that they are potentially more effective than regular standard dose vaccines. The adjuvanted vaccine basically has an additional ingredient that makes it more effective. So in our 65 and older population, we know that this population does not have as robust an immune response initially to any vaccine. So any kind of booster effects that we can give them is always good. And the Fluzone high dose actually contains 4 times the antigen as compared to the other vaccines. So that's been on the market for 5 or 6 years now, and seen quite a few studies showing that that is more effective in this population. Next slide, please. So if I could share my screen, Miranda, I will show you all the available products for the year. And I believe Jesse's going to put that in chat. So this is from the CDC. As you can see, there is quite a few vaccines available this year. This chart gives a nice overview of which age groups they are indicated for, what the dosage is. They all are intramuscular injection, except for the flu mist or the nasal flu vaccine, which is again available this year in a limited population, those 2 through 49 years. So this is a nice chart that you could probably print off and have for reference. The other thing I wanted to mention that was a change for this year, and it's down here in this really succinct paragraph about folks with egg allergies. So even though some of the flu products list egg allergy as a contraindication, the ACIP recommends that people with a history of egg allergy can still receive any of these vaccines, with the caveat if they have had a prior anaphylactic reaction or severe reaction to eggs, that they need to be in a facility, and they specify any healthcare facility, hospital, clinic, health department, physician office that is equipped to manage a potential severe allergic reaction. And there are 2 vaccines that are actually contain no egg. So if there is a history and the provider decides, or the patient and the provider decide that they don't want to take kind of any risk, they can be given either flu block or Flucelvax, which is a basically a recombinant technology that they use to make that vaccine. So just a note on that, because that is a change from previous recommendations. And then also there was a change in one of the pediatric vaccines and the dosage that they need to get for afluria that is of note. Probably not especially for your population, but just something to mention. Okay, we can move to the next slide, Miranda. And if there's any questions, please feel free to ask or throw those in chat. So just a couple other things I wanted to mention. I could probably do a whole section on the antiviral therapy for influenza, and if that's something this group would like, we could probably do that in a future session. But there are priority groups to receive antiviral treatment, including folks that are hospitalized if they have severe, complicated, or progressive illness, or if they're at higher risk for influenza complications, like those higher risk groups that I talked about earlier. Therapy should be initiated as soon as we suspect flu. Even if we don't know if it is a flu yet, and that should be initiated within 48 hours. And for these patients who are hospitalized or have a higher level of illness, oseltamivir is actually the preferred product, which is Tamiflu, which is our kind of tried and true therapy that we've had on the market the longest. If patients are outpatient, there are some other options if they're not experiencing severe disease. So those include Relenza, which is zanamivir. There's an IV product, Peramivir, and also Zofluza, which is our newest, I guess, antiviral. But those are only indicated in patients that are not being hospitalized or having a higher level of illness. I see a question. I'm going to just mention a couple other things, and then maybe we can address that. It looks like a long one. So this is just some resources. One of them is for healthcare providers, kind of more specifically, things you could hang up to kind of give people that reminder to get their flu shot. And we can go to the next slide. I think that's just resources. Yeah, there's a really good series, How I Recommend, that gives kind of testimonials from healthcare providers on how they recommend the flu vaccine every year. And there is some guidance for outbreak management, as well as the, as Jesse put in the chat, testing and management considerations for nursing home residents. So just a lot of good resources there that you can check out for more details, because there's a lot of information. Let's see, Jesse, do you, I'll read the question. For residents, we have done the bivalent and continue to offer on admission, or if they change their mind, we will continue our influenza vaccine clinic and then offered on admission if they change their mind. It sounds like they're doing combo vaccine clinics and reminding staff they can go to county health department or the pharmacies. Yay. So yeah, thank you for that very good information. And I think I will turn it over to Jesse if there's no other.
Kyla, I have a question for you. You know, It seems like we run into these bumps with supply chain concerns and access and availability. Have you heard any concerns yet with the antivirals as we approach flu season?
I have not yet this
Okay,
season, but that has been an issue in the past. Absolutely.
okay. I was just curious.
I don't know if anybody else has any experience with that yet. I think we're just starting to kind of see the uptake on flu cases. So, that could potentially be something that we see down the road.
Right. Yeah, I was just curious. It wouldn't surprise me, unfortunately, but okay. And there is a good Ask a Pharmacist question in the chat for you too, Kyla.
Okay, so it's about pneumonia vaccine.
And then Cindy does have a question. Are all the flu vaccines preservative free?
Ooh, that's a good question. Um, Historically, I know there was Afluria still had a small amount of thimerosal in it. But that is something that I can absolutely research for a Q&A next week and look individually at each of the products since there are so many now.
Awesome. Thanks, Kyla.
So yeah, the pneumonia question, basically the recommendation for 65 and older for the pneumonia vaccines, it seems basic, but if you kind of look at previous vaccination status, it can get a little complicated. But if somebody's 65 and older, they either can get PCV 20 and be done, or they can get PCV 15 followed by PCV 23 1 year later. So I'm not sure that fully addresses your question, but I would be willing to research that for next week as well and make sure that we've got, because it depends on the age of the patient.
Thanks, Kyla.
Yeah.
All
And
right. Well,
I can put in the chat too. There's a really good tool from the CDC where you can put in the patient's characteristics and it'll tell you exactly which pneumonia vaccine they need.
okay, awesome. Yeah, that sounds great. And like you said, we can add that to next week's Q&A, so that's helpful for everyone. Thank you. Well, I'll dive into flu vaccine hesitancy and go ahead and next slide, Miranda. So kind of took some core questions that seem to pop up every year, and especially more so lately as we just look at our current state of affairs. So influenza vaccine, why do I need a flu shot? Why do I need to get it? And really, as Kyla had alluded to, we are seeing increase in circulation, and really there's high risk populations, and with the COVID-19 in our communities right now, there could be kind of a combination of risk factors that merge all at once that truly we want to avoid. So really, you need a flu shot every year to stay protected from the flu virus. And as we know, that flu virus mutates. And we want to protect those that are at higher risk, so that adult population 65 years and older, children younger than 2 years old, those that maybe have asthma or blood disorders, or maybe some chronic lung disease, heart disease, kidney disorders. The bottom line is really, while the US remains focused on COVID-19 and vaccinations and the pandemic, hopefully we're merging into an endemic. We also need to be aware of flu season. And the influenza virus typically spreads in fall and winter. So we're just really seeing flu season kick off. And that peak activity is typically between December and February. So getting vaccinated now is super important and can lower your chances of getting the flu. So really, you want to stay protected and prevent serious illness. And I will tell you that Australia, so the southern hemisphere, just came out of a really tough flu season, and they're in the opposite season. So as we are going into our winter months in flu season, the prediction is that we're really going to mirror what Australia just came out of, and that was high cases. Next slide, please. Thank you. vaccination questions. So if I've received a flu vaccine, do I still need to wear a mask? Really good question. So wearing a mask and social distancing are important to help spread the disease or the virus. However, wearing a mask is not necessarily 100% effective. So really, that's where getting a flu shot is the most powerful defense against flu. Next question, only those with underlying health issues need to be vaccinated, is that right? That is not right. In addition to protecting yourself from getting the flu, getting vaccinated decreases the spread of the disease for everyone. And actually, statistics show us for flu, approximately 20 to 30% of people carrying the flu virus have no symptoms. So even if you think you're at risk, you could also be spreading the illness to someone at high risk of complications from the flu. So really, whether you are at high risk or you're healthy, both perfect candidates for receiving an influenza vaccine. And how serious a problem is the flu in the United States? Well, support the reason for getting a vaccination for influenza. Influenza is the second most frequent cause of death from a vaccine preventable, I'll say vaccine preventable disease in the United States after COVID-19. So, when we look at seasonal influenza rates and predictions and risks of complications, hospitalizations, um, the data is there, and the increase for complications from influenza is definitely presented. Next slide, please. So COVID-19 and flu vaccines. Do I need both the both the flu and the COVID-19 vaccines? The answer is yes. One does not protect against the other. You can get them at the same time, though. So influenza and COVID-19 are both contagious respiratory illnesses, as all of us probably know by now, but definitely caused by different viruses. So that is why we want to have our vaccinations against both of those viruses. I will say that they were working on developing a vaccine that would have both flu and COVID in it. They did not deliver that obviously in time for this season, but the hope is by 2023 fall flu season, they will have a combo vaccine available. So we'll definitely keep our pulse on that. And just, as a reminder, it's likely, and I think we're going to see it, that the flu virus and the COVID-19 virus will circulate together more so this fall and winter. And again, just supports the reason to make sure we're getting those vaccines that are offered to us. So what's the difference between seasonal flu and COVID-19? Symptoms of seasonal flu and COVID-19, unfortunately, can be very similar, but COVID does tend to last longer and has a greater potential to be more severe. And kind of to go along with that, the flu vaccination does not increase your risk of getting COVID-19. So really the danger is getting those two viruses together that could make your symptoms much worse. Okay. Next slide, please. So virus circulation, since influenza virus circulation has been low since fall of 2020, what's the difference now? Why do I need the flu vaccine now? Well, if we really think about it, and perhaps we need to remind ourselves or our peers or our families or our residents that a lot has changed between then and now as far as what we were doing to protect ourselves. Travel bans have been lifted, mask mandates have been lifted, larger community gatherings have resumed. So that coordinating with going into the flu season, we could very well see a higher flu transmission than we have in previous years. And actually, Miranda, if you wouldn't mind bringing up, I have some current information. It's the weekly flu data tracker for influenza positive tests that were reported to the CDC. This would be as of just a few days ago, actually, the report. And if you guys take a look at that on the bottom right-hand corner, we are seeing an uptick that's almost untimely going into October. So now is the perfect time to get your flu vaccine, as it typically takes about 1 to 2 weeks for that immune response to set in. All right. Thank you, Miranda. Next slide, please. So influenza vaccine, another question we get, the last time I was vaccinated for the flu, I still got it. How does that happen? So the gist of it is, again, it takes 1 to 2 weeks after vaccination for that protective immunity to develop. Oftentimes people that are vaccinated later in the season, they may have already been infected with the flu virus shortly after being vaccinated, and they got sick. Really, the side effects are pretty minimal. Mild fever, muscle aches are the typical side effects after vaccination. And like Kyla mentioned, the stomach flu, I believe is the referenced, what we call it, is much different than this flu. And just to reiterate the timeliness for getting vaccinated, now is the time, especially as we see this uptick starting, and we know what Australia just went through, and we've had a lot of mandates lifted. It's almost the perfect storm. So we want to do as much as we can to protect ourselves. And really, the studies, the statistics show that the flu vaccination reduces the risk of flu by between 40 to 60% among the overall population. So I think that's a pretty good win. All right, next slide, please. All right, I have a few resources that we will share forward with you guys, and I will drop them in the chat. Anyone have any questions? Do we have any more questions in the chat box?
Jesse, I saw one in there wondering about the Montana Department of Health, if they put out like a weekly flu cases. I know they do that in Alaska. Do they do something like that similarly that we could share in Montana?
Yes, I feel like there was a, who is Holly? Okay, let me look and see, Holly. I feel like there is a database you can go and check. I'll follow up and ask. And I don't know, Erica, are you on the line today? Erica Baldry? I don't know if she was able to join us today. I'll find out, Holly, because I feel like there is, and I will let you know.
Okay, Kathy's asking, where did you get the information for slide number 5? Look at slide number 5. About the influenza burden. Yeah, that was that's from the CDC, basically. Do you want me to send you the link? I can put the link in chat as well. I got all my stuff mostly from the CDC.
I'll drop the link in right now, Kyla, for.
Yeah, somebody said thanks. A lot of our staff are waiting till the numbers get higher before getting their vaccine. So get it. Yeah, the CDC actually says you can get it starting. They recommend starting in September and hopefully getting it by the end of October. Just kind of trying to cover that kind of range that Jesse mentioned, with the peak varying between December and February on most years.
And Kathy, tell us what.
Yeah. Being up to date. So are we talking about the bivalent booster now? Yeah, we had done, I believe on our presentation last week, we had some Q&A about up to date that we can share, Kathy.
Yeah, you bet. We'll share it out. I'll send it with next week's reminders. And then we'll update the Q&A too that we talked about with the pneumo and the preservatives for if they're what flu vaccine's preservative free.
Yeah, I'll make sure and get the information for each of the vaccines. And then also about the pneumonia, we did do a previous session on the pneumonia vaccine updates that we can also give another link to so that folks can maybe look at that slide set or the recording. Okay, one more question. If a staff or resident had COVID less than 3 months ago and it has been more than 2 months since their last booster. Okay, that's the slide. Basically, they would be considered not up to date if they waited past, if they didn't get it at that 90-day time frame. So if someone has had COVID in the last 90 days, they're basically up to date until past that 90-day window. Does that make sense?
It's essentially if you're under that mark or over that mark. If you're under, you're still considered up to date. If you're over, you're no longer.
Correct.
Right on. All right. Well, thank you everyone for joining us. If you have a moment, please complete the survey. Otherwise, we look forward to seeing you next week, same time, same place. Thank you for joining us, and we'll send out all the information with next week's reminder. Thank you, everybody.
Bye, everybody.